Greetings.
Hello.
It's a pleasure to be here this evening and thank you guys for staying. I know it's a late night. I want to introduce the other panelists for this evening. You'll have Mr. Donald Richardson and Dr. Mary Carey. And they will also speak about things that they're doing with congregations. And after we're finished, we hope that you'll be able to list ways to promote wellness within local congregations and also identify steps to integrate wellness interventions. And like Marisa said, you have your flash drive in your packet. And so you have the manual there. And what I'll do during my presentation is just briefly go over some of the things that are in the manual, and then you can look at the manual at your convenience. First, I would like to give a little background information about the Healthy Congregation Manual. The manual was developed in June 2011 out of initial discussions between myself and Corey Love, who is a program coordinator with the Local Communities of Excellence program in Tulsa County. The program wanted a toolkit of information they could use while working with congregations to address health and wellness. Before anything was developed, the program staff in Tulsa actually went to congregations and did an informal survey with congregational members. And so some of the results, out of the 6 congregations that they gathered informal information from, all 6 had established norms of being tobacco free, 5 did not have a health ministry, and 5 were willing to implement a health related program. This was good information because it gave us direction to follow as we move forward with developing materials. Our main purpose was to create a resource that promotes healthy lifestyles. And in public health, we put emphasis on engaging systems to improve the population's health. Congregations are a system within a system. Within each congregational setting, there are systems in place that work together to ensure members are supported in their spiritual growth and so forth. And congregations are also connected to systems that have been established in local communities serving as major influencers. And I think we heard some of that tonight. When you review your electronic copy of the manual, you will not see references to scriptures or one particular religion highlighted. So our approach was to link public health systems and with the congregations and be inclusive at the same time. So congregations can tailor the materials as needed. And the manual focuses on tobacco prevention, physical activity, and nutrition. And next, I'll just briefly review components of the manual. An overarching piece of the manual is creating a tobacco-free environment. One of the most effective ways to do this is to adopt a policy or make it an established rule. This lets everyone know that your property is tobacco-free inside and out. Posting of signage serves as a tool to make tobacco-free properties a standard that becomes the expectation. The manual gives information on the benefits of being tobacco-free, tips for quitting, and how to receive help with quitting. And as congregations continue to address the spiritual needs of its members, there are ways to incorporate physical activity and nutrition. One example is spiritual walking. This intervention incorporates prayer, walking, and reading scriptures in a group setting. And so this is something that congregations can do during their study sessions, midweek, or on the day that they worship. There are tips on healthy eating, portion control, recipe substitution, ideas, and many more things. And you'll also find facts about tobacco use, physical activity, and nutrition that can be used in bulletins or announcement sheets. And so we really felt that this information was important. And when you look at the manual, you'll see the actual source where the information came from. So if you do want to use that information, you have the source so you can cite it, and you know that it came from a credible source. And it also includes tips on how to promote congregation health within communities. So the first tip on how congregations can help promote health within communities is first joining a local health or turning point coalition as a way to become and stay connected to local and state level health issues. Because when congregations are connected on that local level, they'll know what's going on within the local communities regarding health and on the state level. regarding health. And so if congregations wanted to actually um, form and get together to advocate or educate about issues, they'll have that information. And that also came out tonight, which was good to hear that the participants here are also moving in that direction on involving local coalitions. And we also wanted to make sure that there were well resources available, and also we wanted to make sure that the health equity campaign statement was forefront. And so you'll also see that in there because it's real important that we keep health equity at the top of the list because sometimes it's at the bottom, and we want to make sure that everyone is aware of the need to achieve health equity. One of the things that you won't see in the menu that we realized afterwards was that there needed to be a tool to assist the local program when meeting with the congregations. One of the things that we developed, it's like an assessment form, and we used stages of change model with their form so the local program could actually speak with congregation representatives and determine at what level the congregation is really ready to implement health interventions. And so if they're pre-contemplation, then there are certain things that the local program could do to assist the congregation when they're ready and not actually force them to implement something that they're not ready to implement because I think someone else also mentioned today that we pass policies, but the implementation is hard. And so if people are passing policies and agreeing to it, but they're not actually bought into it, they may not actually enforce it. So we really want the policies to be enforced. Or and so that was the readiness assessment. And so it is that conversation piece, and it identified what's already happening, an indication on where to start. And we also helped them with a form so they could go back in 4 months and 8 months to see if the congregations were ready to start working on health issues. So, one thing that I want to mention, there's a statewide Certified Healthy Oklahoma program and congregations was added this year. This is a way to be recognized on a statewide platform with other health partners. The application period is from August 1st through November 1st each year, and I believe Marissa passed out some materials. And so if you miss the application process this year, you can apply next year. So that's one thing I want to make sure that I stated tonight. And also, one thing I wanted to state is that when we developed the manual the first time, it was for a particular program in the Tulsa area. And so what we're doing now is we're going back and we're looking at the manual and we want to make some updates. And so we want those updates to have input from different congregations across the state. And so that's something that we'll be working on within the next 6 to 9 months. And if that's something that you're interested in, you can let Marisa know if you're interested in that, or you can let me know tonight if you're interested in assisting with that. And one thing that I want to also state that was also stated tonight is that according to the 2013 United Health Foundation America's Health Rankings, Oklahoma is ranked 44th in overall health among states. And so improving the health of our state can't be done alone because we're 44, we're almost at the bottom. And we have the tools to make improvements. We just need to put them into action. There are approximately 6,000 congregations in the state of Oklahoma. When I got that list, I was like, wow, I didn't realize there were that many congregations in Oklahoma. And so you can see how much power congregations really have when you put the numbers to the paper. I mean, there's power in numbers. And so with 6,000 congregations, there is so much that can be done. And then when you think about that, and you think about we have local programs out there. We have 48 community excellence programs across the state that are working on health issues. And we also have programs like Donald's program that's funded by the state health department working on local health issues. And then we have our local health departments, health initiatives, and motivated people across the state. And we all work together, change will happen. And that's one thing I think that came out of tonight after we reviewed the film for me is if we all work together and as a collective, we can make things happen right now we're in our silos working alone, and so it's really hard to do things alone. And so before I finish, one thing I want to read something to you that's in the Healthy Congregation Manual, and I do hope that you go back and you actually look at the manual and look at the resources. Like I said before, it was developed for a program in Tulsa, but I do believe that the resources are transferable, and I hope that you enjoy those resources. But one of the excerpts from the manual, and I just want to read this, and it uses an analogy of a garden. And it just says that we're at a crossroads. Due to the lost lives each year, this crossroads is like a garden that has been left unattended for a lengthy time frame. Assistance from experienced gardeners is needed to reintroduce nutrients and till. The proper tilling of this garden consists of pulling weeds that are slowly taking our loved ones away, decreasing our years of life, and affecting our ability to be productive workers. It would take countless gardeners to assist with preparing the soil for planting lasting habits that will improve our health. Local congregations are at the heart of every community throughout the state, and we need your help. We need your assistance working with your members and surrounding neighborhoods to make tobacco-free living normal, protect everyone from secondhand smoke exposure, and promoting healthy eating and physical activity. This manual provides examples of things a congregation may do to garden side by side with public health and organizations across the state to promote wellness as we create a state of health. And that's one thing, if you didn't know, for the health department, that's our vision, is creating a state of health. And one of the panelists said we need to create a culture of health. And that's what we're striving to do, is create that culture so health is not something that's second guess. It's something that becomes the norm, that we just expect it to be. And so that's it for me, and I'm going to turn it over to Donald Richardson, and he'll give you some information about what he's doing with local congregations.
Hello? I'm good? Okay. My name is Donald Richardson, and I am with the African American Empower Program. We are housed at Guiding Right Incorporated, located in New York City. Is this the clicker right here? Okay. Nope. Okay. I have to move. We're charged with identifying businesses, programs within the African American communities that service the African American community and assist them with developing tobacco-free policies. There are actually, before I go on with that, there are actually two other programs such as ours located in the state of Oklahoma. You have the Latino Empower Program at the Latino Community Development Agency, and you have the Native American Empower Program located in Pawhuska, Oklahoma. And we all generally have the same focus on helping entities within our communities become tobacco free. And now I'll go over the acronym EMPOWER so you guys can know exactly what it is that we do. Okay, first, throughout all our communities, we want to monitor the community, see exactly what Big Tobacco is doing within our particular communities. And of course, if you are from, or if you know anything about how the Big Tobacco companies operate in African American communities, they bombard us with the advertisements. They put a lot of money within our communities to get us to start smoking. The next is the P, to protect. Basically, introducing policy, helping those entities that don't have a tobacco policy have one, helping those that just have a smoking policy go towards a tobacco policy. Okay, we offer assistance with quitting. Basically, all the entities that we work with, they advertise 1-800-QUIT-NOW. So We do offer assistance with quitting. The W, we warn our communities about the ills of alcohol, of tobacco within our community. Um, we do it through print media, radio ads. We've had entities that have signed with us uh, that we advertise within the newspapers within our communities. Black Chronicle, we've actually advertised in Daily Oklahoma, things of that nature, letting everyone know that these are the places that are becoming tobacco free. We try to engage the community, and we try to raise the community, basically raise awareness about just not just our program, but about tobacco in our community. Now, I keep saying entities. Back when we decided to do this program, we were kind of wondering which direction that we were going to go in as far as like, okay, where do we start? So we had a whole year to where we were just in the planning process. Who do we want to work with? Why do we want to work with them? So we decided to do a storefront project to where we were wanting to see exactly how many stores within our communities were basically not just promoting tobacco, but promoting alcohol and other things that were ill in our community. So we decided, okay, well, what's the best route to go? In Oklahoma City and African American community, we know that there is a church everywhere in our community. So we decided, hey, we're gonna start working with churches. And then we were like, okay, where is now in the African American church, it's probably 75 to 8%, and I may have the numbers wrong, 75 to 8% African American women. So we decided now how are we going to reach the male population. So we were like, well, hey, I get my haircut every week. So we decided that we were going to start with the African American church and the barber and beauty salon located not just within our community, but also outside our community, because we do have a lot of churches outside that are not actually in African American communities, but still service African Americans. So that's the route we went. The picture right there is just a sample of some of the policies we signed. One of those Prospect Missionary Baptist Church, which was probably one of the first policies that we did sign. It's a bigger church within the African American community. That church and St. John's, they're probably the two biggest churches that we signed. And we knew if we signed churches such as those, that others would follow. And like I said, what we've done with them, you can go to the next slide, is basically, our main point is to help them to develop a policy. And this is just a sample of the tobacco. We have tobacco/wellness policy. Initially, we were signing everyone to tobacco policy, basically saying that there would be no tobacco on the premises, no smoking outside the premises. I mean, not even in your car if we could help. Of course, there's really no way to monitor that. we provide them with signs when they're putting out information, and we provide them with the signs, no smoking 15 feet within the building, things of that nature. And that was provided, of course, by the health department. Go to the next one. And this is another example of us working with the community. These are actually pictures of one of our annual events called Kick Bus Day. And during Kick Bus Day, we decided that we were going to go to several local parks. The first year we did it, we went to several local parks located within the African American community. We partnered with various agencies in and outside the African American community, including the health department, the Oklahoma City County Health Department, and there were other businesses decided to help us, and we cleaned up the parking center. So it was, I want to say, the first year we did 4 parks. We realized that first year we spread ourselves a little bit too thin. So the next year we ended up doing, I want to say, just the one park, the biggest park, which is located off of, I want to say that's 10th and I-35. We really didn't have a big turnout as far as like people assisting us. So that was great. Next slide, please. Another example of pictures of policies that we signed. The next slide would actually be the actual name of all the policies that we signed. You go to the next one. In all, I want to say, as far as like faith-based organizations, African American churches, and the haircut establishments and other businesses. We have 2 state farm agencies, a funeral home, a counseling agency. Well, I guess several counseling agencies, and all these entities do service the African American community, which of course is who we're trying to impact. But in all, I think I want to say we signed close to 50 policies. Phil, would you say? Close to 50 policies, and that's in Oklahoma, Tulsa, Carter, and Connecticut. As far as our future is concerned, we're deciding to go. Well, we're going in the same direction the health department is going, which that's our funding. We're going to do a total. We're going to try to work with the churches that we work with now and have them to adopt their policy to where it's a total wellness policy. Health and physical activity. We're not exactly knowing how that's going to look yet, but with guidance of the Health and Congregations Manual, once that's all the way developed, and with the direction that the health department is going in, we'll take it from there. If you'd like to contact us, there's our contact information. Again, my name is Donald Richardson, and Stacey Moore could not be here tonight. She had class, but we are the Staff and Empower Program. Of course, our privileged leader is Mr. Theodore Noel, sitting back there in the back. So again, thank you, and now I'd like to introduce Dr. Mary Perry.
Thank you, and good evening. I don't have PowerPoint slides for you, but I will direct you at various points in the presentation to our website, which contains the St. John Missionary Baptist Church website, which contains many of the points I plan to make. Approximately a year ago, Dr. Jemison asked me if I would be willing to take over the role of Wellness Initiative Coordinator. It was previously held by Dr. Betty Jobert, who was one of the managers at Integris, and I understand she moved out of state and is now directing a hospital in another state. And so the pastor said, I want you to pray about this. Okay, well, anytime you say that to me, you're going to get an automatic yes. I guess he probably didn't know that when he told me to go home and pray about it, I was going to say yes, but it's something I believe in wellness. Earlier, I had mentioned that prevention costs less than cure, and I'm a firm believer in that. I have become a preventionist, especially as I age. So, the website lists the purposes and first of all, our mission, the mission of the St. John Wellness Initiative is to promote wellness of the human mind, body, and spirit. And the purpose, of course, is to serve as a liaison between church, state, and private agencies for the formation of wellness partnerships that mutually benefit members of the church and the global community. I'd like to describe several of our most recent initiatives. I am a professor emeritus from the University of Oklahoma, and after serving as a faculty member there for 25 years, I learned that you can conserve a lot of energy if you don't try to reinvent the wheel. So when I identified that the Oklahoma Healthy Aging Initiative had an absolutely wonderful chronic illness self-management program, I worked to have the program brought to the church. And we actually had it on site. We have a wonderful meeting room. And the pastor is very generous in terms of promoting the use of that for community-based initiatives. So we sponsored the chronic disease self-management program for 6 weeks. It ended July 3rd, and it was a success. Are any of you familiar with that program? Just a couple folks? Okay. So just briefly, the program participants openly shared from their own perspectives and walked away with tools for better breathing, techniques to control symptoms such as sleeplessness, pain, fatigue, and depression, strategies for preventing falls, relaxation techniques, and making informed treatment decisions in collaboration with their physicians and caregivers. I not only organized the program, I was a participant because I too, since I'm now at Medicare eligible, also deal with at least one chronic illness. So it was very worthwhile. Now, the really great part of this is one of the members of the class decided to take the training. And she will participate in the next training session and will become a certified teacher in this chronic disease self-management program. She will not only be able to teach future classes for us, but she will be able to teach under that Oklahoma Healthy Aging Initiative. So, baby steps, but we feel, that we were successful with that initial class. The next class we brought in was a Tai Chi class, Moving for Better Balance. It started on July 17th and ended October 2nd. And we had this class every Thursday from 3:30 to 4:30. How many of you are familiar with Tai Chi? A couple folks, some of you participated maybe in a class. The Tai Chi class is an evidence-based fall prevention program. Accumulating evidence suggests that Tai Chi, the 8 form exercises comprising it, are an effective means of improving balance, functional limitations, muscle strength, and very important for the aging population, the prevention of falls. I also participated in that, and it was very, very worthwhile. And once again, one of the members of the class became so excited about Tai Chi that she went through the training to become a Tai Chi instructor. So she can now help to teach future classes on site at the church, but she's also available again through the Oklahoma Healthy Aging Initiative to teach other classes. And then one of my loves is water aerobics. So I organized, in collaboration with the Oklahoma University Health Club, a water aerobics class for the members of St. John. Now, this was just the introduction to water aerobics. We're still attempting to identify funding for the ongoing offering of that class, but we did have at least the introductory class. It was taught by a graduate student at the University of Central Oklahoma who is a wellness major, and we had a wonderful time. And if you've not ever participated in water aerobics, it's really great for providing an opportunity for exercise without a lot of pounding on your joints. It's just really great. It's relaxing, a wonderful stress reducer. Another recent initiative, I can't even call it an initiative. It was more of an activity. With the recent Ebola crisis and the outbreak in West Africa, Dr. Jewison approached me about doing a presentation to our congregation. And we didn't take much time. After all, we're not there for health education. We're there for worship. But he imposed a strict limit, and I was able to generate a handout from the Centers for Disease Control about the Ebola virus, gave a brief 10-minute presentation, and was available after church in the fellowship hall to answer questions about the virus. So it was the beginning of some short bursts of health education with a planned mechanism for follow-up. Now, I'd like to just say a little bit about what you'll find when you go, or if you go to the St. John website. It's http : and I'll get, well, you know how to get this, and then maybe you could have it available or disseminated. It's pretty easy to find on a search. STJOHNOKC.org, St. John's OKC.org. You will also be able to see what some of our other ministries are doing in the health area, such as the Grief and Loss Ministry Joy in the Midst of Sorrow. That's headed up by Annette Kurt Burley, who is a social worker and has done extensive work in the area of grief and grieving and helping individuals through that process. And her contact information is also listed there. You'll also see information about our fabulous Nurses Corps. They are on duty every Sunday. And if you have a concern or if you need your blood pressure taken, they are available in a clinic area on those months where there's a special initiative like Diabetes Awareness Month or Stroke Awareness Month. They may be available for blood tests in terms of glucose screening, cholesterol screening. So they are on duty, every Sunday, offering opportunities for assessment and for intervention. They've had several congregation members come and be examined, and they actually had to send them to the hospital. So the congregation knows they're there, they rely on that, and they are just very helpful. And that ministry is headed up by Renetta Johnson, and her contact information is also on the website. Then we have the physical fitness ministry headed up by Jeff Washington. They offer a aerobics class on Tuesdays and Thursdays from 6:15 to 7:15. In season, they also offer men's basketball, and then they have an annual golf tournament. Now you'd say, how does that fit into wellness? Well, it is exercise, and it counts as wellness, and counts as a wellness promoting opportunity, and so folks look forward to that. Then we have the VIP ministry, the Seasoned Saints ministry for individuals 60 years of age and older. And each year we have a health fair with vendors and screenings and healthy food offerings, and our congregation looks forward to that. And that ministry is headed up by Alice McCann, and her information is there. You might have attended one of the American Heart Association Power to End Stroke events. In the past, we have served as hosts for that event, and we've had individuals come in and speak during the morning service. Some of those individuals, Marvin Sapp came in one year, Reverend Kirk Franklin came in one year, C.C. Gobbo, who is a contemporary Christian artist, came in one year. So we not only have a chance to hear information about stroke awareness, but we have screenings after the program is over, availability for information. So it's it has been very successful in the past. Also on the website, you will see the link to the Oklahoma State Health Department list of classes through the Living Longer, Living Stronger with Chronic Condition. We have a link on the St. John Missionary Baptist Church website to that listing where congregation members can go and identify, when the next offering is going to be, and information on how to register, and other helpful bits of information. We also have a link to a medication awareness site. It offers a toolkit for families, and pretty much anything and everything you would want to know as a layperson about medication that could be helpful to you and your family is available through that link. For, I would say, a nominal donation, any organization can apply to the Patient Safety and Information organization to have the status of being a supporter, not only being a supporter, but have unlimited access to all of their literature, their media, a wealth of information about medication safety. So briefly, that's what we're doing. Here again, we're taking baby steps in a number of these areas, but The feedback I get from the members of the congregation is that what we're doing is helpful and worthwhile. So, I'd be happy to answer any questions. Do you have a question to answer? Oh, yes, and you have a tobacco-free policy. Yes, we just signed. Yes, of course, our name was up there. Just signed a new tobacco-free policy, and so we're really excited about that. So thank you for your attention, and thank you for staying to hear about